So I'm going to start the talk. This is on HS kind of wound management. So with this, sorry, just to let you know, I have no conflicts of interest. I'm not getting any sponsorship from any companies for the products that I mention. It's just using my own experience from my clinical setting as a registered Advanced Nurse Practitioner in dermatology. So I said I would, before we talk about wound management, I thought just to mention and understand how HS works or how it evolves in the skin. It's an infection which occurs in hair follicle, so it's boils, occurs, and they continue and enlarge to become abscesses. The hair follicle bursts and releases pus and fragments of hair, which is keratin, into the deeper skin, which causes sinuses. These two adjacent abscesses join up and form a sinus tract. The release of the pus and pieces of keratin causes the immune system in the skin to be activated. And it's this activation of the immune system that can lead to repeated inflammation. And this is the cycle of your HS. So just the main areas that are affected will be your under the arms, under the breast, the groin area, the buttocks and the tops of the thighs. They can affect the back of the nape of the neck because that's a hair-bearing area. Sometimes the tops of the thighs, and generally it can affect the areola around the breasts. And these are all generally because they're the hair-bearing areas. So just as patients, when you go into clinical settings, it's important to understand the kind of the wording that your consultant or your GP may use. And this is called, for diagnosis, as the Hurley staging. So there's stage 1, 2, and 3. So stage 1 is your painful bumps, pustules, and abscesses in the armpits, the groin, in between the buttocks. And these bumps are generally start as a firm pea-sized nodule. Stage 2 then would be reoccurrent abscesses, single or multiple widespread lesions in the hair-bearing areas, and they often form sinus tracts. And this would be your moderate HS. Stage 3 then is your diffuse or broad involvement with multiple interconnected sinuses, and this is your severe HS, which leads to your restricted movements if the scars are left. So just the general management of HS. So the HS treatment should be tailored to the individual needs. So if your doctor is prescribing you something, talk to him or her about what they're prescribing because it may not necessarily suit what you have. There is no uniform approach to treatment. Main thing is that you will be told if you smoke is to stop. That's because the nicotine can affect the hair follicle, and weight management. So people who generally are overweight will be encouraged to lose weight because of the friction of the skin folds. But the caveat is that it may not work for your HS to prevent your flares. So even if you do either of these, it can still occur. Regular pain relief is really important with your HS, especially at your dressings. So talking to your GP or your consultant about the type of pain relief is really important. And especially when you have mild or moderate or severe pain, different painkillers are required, and sometimes we don't think about that when we're prescribing. Avoidance of mechanical stressors. So mechanical stressors are about telling yourselves is to avoid skin trauma. So that's when two pieces of skin rub together to avoid excessive heat and the shearing trauma, and that can just even be from clothes. So that would be avoidance of tight clothing. So females or males will tell them to wear loose cotton fitting boxer shorts, clothes that aren't too tight. And then the next one would be exercise as well. And obviously as clinicians, we're recommending that you lose weight to help your HS. But we know that exercise can cause sweating, which triggers your HS, which hurt and difficult to keep the bandages in place. So there is certain garments that have been developed like this hydrowear that are designed to keep dressings in place. And I'll talk a little bit about them later. So I think sleep, which is an identifiable problem with pain, reduces the sleep. So the recommendations would be like obviously sleep in a cool room, use a mattress topper that can help regulate your temperature. And just to say that fatigue definitely accompanies your abscess and inflammation, and being aware of that and actually going with your fatigue and resting when you need to as opposed to kind of fighting it can definitely help with your HS. So again, self-management. Proper wound care is the key part management of HS, particularly in patients with advanced HS. It can be difficult to manage your wounds for many reasons. It's well documented that HS sufferers have reduced quality of life. This is because the pain, anxiety, and definitely worsens during your flares of HS. So I often ask patients at times what it's like to have HS when they're in the clinical setting with me. And one patient described her HS, she was a stage 1, and she'd only have 1 or 2 nodules at a time, but she felt they were like dormant volcanoes, just constantly waiting to erupt. And to be honest, the way she described it has really kind of affected how I treat HS patients and kind of respond to their needs with the wound management. So the wound management care can be tricky to manage for each lesion, and it may be difficult because the wounds are at different stages. So early signs and symptoms of HS or under the breast, including pain, you can actually get itching associated prior to any flare of your HS, and you can get excessive sweating, which may occur 12 to 48 hours prior to a lesion appearance. So it's just little things like that can give you a notice that you are going to have a flare. The problems when choosing dressings is the amount of exudate that you have, the pain on removal, dressing staying in place, odour management. And one patient I read in an article talked about dressing changes and the places to actually do these. Dressings or flares in your HS aren't going to occur at the most convenient time. So one patient was saying that she actually uses the disabled toilets to do the dressings, because in a cubicle in a normal toilet you don't really even have room to hang up your handbag, but you do in disabled toilets. That there was the baby changing units, and she felt like a fraud because she felt like she didn't have a disability, but when she learned to accept that actually her disability was under her clothes, she felt much better. So I stuck this plaster up because, well, it would be great if a Band-Aid fixed your HS. So wound care guidelines we know are very limited. The main aim is to minimise skin trauma, to manage the pain, so they should be absorbent, non-irritant, keep the surface dry. So that's not just the wound itself, but this area around your wounds need to be, because that can cause a lot of trauma as well, and pain what dressing changes. Absorb smell, avoid sticky tape as much as possible, and prevent staining on your clothes. And one of the tips patients gave me was that white clothing showed less of a stain than the dark clothing. So where do we go with these dressing changes? The main aim of the dressings is to decide what suits yourself. Again, all of them are tailored to yourself. There was a talk that I went to, and it says that patients spend around 300 minutes per month doing dressing changes. I mean, that's an awful lot of time taken out, and one American study showed that it was 960 minutes, like 16 hours of a month of doing dressing changes. So we know we should dress our wounds, but how do we choose which way to go, especially with the amount of time that it takes? So we know it affects hair-bearing areas, if we like the groin or the axilla, so it does mean getting rid of the hair follicle help? And this is often a question that we get asked. So it's about considering the type of hair removal. Shaving can cause more harm because it nicks the skin, and it can be quite hard with the vessel that you use. Also, waxing can be just damaging to the skin. So I often get asked about laser hair removal, and I'm quite conscious that it is expensive, and that it might not work for everyone. But patients with mild HS, laser hair removal can destroy the hair follicle that become blocked and cause lesions. The treatment can remove sweat glands, reduce bacterial growth and to the affected area, therefore reducing the inflammation and the pain associated with it. It can reduce the symptoms, but it is important to remember that it does not necessarily mean that it won't prevent any flare-ups, and that's important to understand. I often tell our patients who are ever deciding to go for this to make sure that the person who is doing the laser, that actually they know about your wounds, and that you may have to cancel short notice because you have a flare-up, and sometimes you can look for deals, get one area. So the next part that I talk about is deodorant and the affected areas. So deodorant versus aerosols. So deodorant masks the symptoms of the smell, where the aerosols is more your antiperspirants. So obviously when you're doing it, it's trial and error. The deodorant is more that it will affect the surrounding skin or the peri-wound when you're putting on your dressings. Deodorant doesn't cause HS, so some people feel that it will cause it, but what it can do is clog the pores if it's a roller stick. It can close the pores and make them your HS worse or give it a flare. So always make sure that you try and get a non-aluminium or paraben-free antiperspirants, or really make sure that the dressing changes are regular, and it can help with the odor. So antiseptic washes, never all consultants will recommend chlorhexidine washes that are always mentioned in the guidelines. There's not great high quality evidence to advocate its use. Sometimes when there is a superficial bacterial infection, they can help. Chlorhexidine, I've just been told, isn't available, but Milton Bat is an alternative for that. Avoid using fragrant soaps or spraying deodorant onto the lesions. Use mild non-scented shower washes, and do not wash with face cloths, loofahs or brushes. It's not that it's the trauma that they can cause can make your HS worse. So now we'll talk about the dressings. So HydraWear is a product that is outside on the stand again. It's the garments, there's 3 parts to the garments. So you've your garment, your wound pads, and then you have fasteners that go with these. The great things about them, and the feedback that I've got from patients, is that the dressings do stay in place. They're quick dress changes, especially when you're out. They do kind of get the areas that are affected, improves the quality of life, reduces the pain at the dressings, and it can affect the odour because you're doing more regular dressings. And just that these are actually on the medical card. So you can get your GP to prescribe a medical card on a pink stock order form, and they get it through the community, and you get a garment plus dressings. And then the private prescriptions, you can actually get a normal prescription and go to your GP or your chemist and get the prescriptions. So the next one then would be Polymem. Polymem is a dressing, and it looks like this here. It's a soft plastic sponge. Its 4 components are that one is it's a surfactant, there's glycerine in it, there's a polyurethane foam, and a semi-permeable backing. My experience with this dressing is that it comes in different sizes and shapes. We often recommend the one up the top there that has the backing and the plastic on it. This one here and these ones would be for if you have a sinus and you need wick, so you need a sinus tract and you need it packed. The surfactant part of the dressing then, it's mild, it's non-toxic cleanser, continuous cleans of the wound, it supports analytic debridement. So basically it just continuously debribes, and the main thing is that the patient is aware that it increases your exudate. So for dressings like this, it actually pulls all the exudate and the pus out. It can do that over 7 to 2 weeks. There is an increase in pain with that, and you may feel that it's doing more, but it is actually pulling all the wound out of the dressing. With these, sometimes for a cheaper alternative, these aren't on your you can get them through the community nursing, or you can get them on the medical or the PCRS, but there's very limited ones you can get. So for cheaper, you can get these directly from the company, and they do, ISCAS is the company, and they there's a line that you can ring to get dressings delivered to you at cost price. Sometimes what we'll tell our patients is to use these when initially before the flare, and as they are having the flare, until all the exudate is on. So you keep that on till the exudate hits the top of the wound, and then you change the dressing. And when it gets lighter, you can use a simple Mepor or a normal plaster then once it's light. The glycerine then, part of the dressing, maintains a moist wound environment, keeps the dressing from adhering to the wound bed, and helps with the pain at the site. So what's the alternative then? The desired characteristics of HS wound dressings include that it doesn't hurt the surrounding skin, its antimicrobial properties. So silver impregnated foam dressings is considered the most optimal because it does help with the odor, and it has antibacterial dressings, but these are very expensive if you were buying them on your own. So you can get referred, and I was talking to a tissue viability nurse in our department, and she refers all patients to the community for the dressings. So you can ask your healthcare provider, can you be referred? And all they need is a letter to send to the community nurse. And there's a different foam borders. So not only is there these ones, but Eleven as well is a good one. It's a soft, and it has a silicone backing dressing, so it doesn't hurt the surrounding skin. So these are considering, there's different ones. So just to show you that there's different shapes of dressings out. This one is for a sacrum, and the size, you can get different sizes, but just to be aware that they all come in different. So if you are short of dressings, that there is different types and not just your normal square one. The foam borders also come in sacrums and heel shaped, so they can also be used to fit nicely under the arms. They come in light and moderate to heavy exudate, and you may need to add an antimicrobial hydrofiber such as Aquacel, something like this. This is Aquacel AG, so it has an antibacterial in it. These are if you think there's any bit of infection, it can help. You can get ones that just with Aquacel without the microbial, and these can be used if you feel that the wound needs a bit of packing. You can use them underneath the dressing, just for the heavy exudate. And then again, as it gets light, you can change to a cheaper alternative. Just if you were using the Aquacel foam or Aquacel or something similar, the hydrofibers, they can dry out in the wound. So you need, if you were having a shower, you could pull it out that way when it's wet. They do turn to a gel when they're wet. That's the ideal time to to take the dressing off. Then my last thing is, when we talk about wound dressings, straight away, like, people often say, oh, you know, just use a sanitary towel as an alternative dressing. There is good soakage in baby nappies and breast pads because the moisture wicks away from the surrounding area and does keep the surrounding area less damaged. However, I don't really think they're alternatives to dressings, but I did put them up. So we have, patients do tell us that they use J-cloths, gauze pads, wound pads, for when they're cut or short, or they are out and about and they do end up having an abscess burst. These are our alternatives if you can't get any dressings. And I think it's important that we do say that, like, these are only alternatives and they shouldn't be a standard for patients with HS, because you wouldn't tell if someone had a leg ulcer, you wouldn't be telling them to put a sanitary towel around their leg to absorb it. And then the last one that I have read about is patients putting Vicks on their wounds to help with the pain. But it's not recommended that you just don't apply non-medicated honey, aloe vera, Vaseline, or tea tree oil, because that can cause folliculitis around the area, which can then worsen your HS and the healing. So that was a quick stopover of things. But is there any questions? I was going to go through things, questions, or is anything to go through? I'll just go quickly then. Just some patients then find that the area around the skin, especially with high exudate wounds, leak a lot and affect the surrounding skin. There is a thing called Cavalon. Cavalon is a barrier film, and if you want to come up, you can have a look at trying it. It comes in lollipops. There is going to be another version of this that can last on the skin 7 days, but this comes on and you just put it on the surrounding skin. You can put your dressing on that, especially if you feel that dressings are pulling off, and especially if the average is 2.8 dressings per day, you will find that you're going to irritate the skin. So that's the Cavalon. They were actually designed for stomas, so all around, especially putting on the stoma bags. And we do find that patients, especially if they're just using like gauze types, just simple gauze and a bit of tape. The tape, we do say use the white plain hypoallergenic tape, but that can still pull the skin, yeah. And you can, on Amazon, some of our patients go on Amazon and buy dressings. There's Cliniderm and Sorbex are two super absorbent wound pads, and they're really good at taking away high exudate. The only thing with them, they come in all different sizes. It's just not to cut them. They're designed to absorb, so try and get the size that would suit the size of your wound, as opposed to trying to buy the large to cut around. There's just little dressings. These would be more that you could get from your public health nurse. These ones are the soft border around, they're silicone based, so when you pull them, they aren't very harsh on the surrounding skin, and there's good absorbency. And it would be something like this with Aquacel that you could pack the dressing if you feel that these dressings don't absorb enough, or that you have to do a real high changeover. Then the Polymem, these are again something similar to the Aquacel. They're wicks, so they're cut to size of the wound if you do need it to be packed, or it's a high exudating wound. Some tissue viabilities have talked about Inidine. It's a dressing, it's kind of yellow in colour, and it can dry out the wound. Sometimes what we'll say is make sure that they don't dry out the wound that causes a bit of a scab on them, because the wound or the exudate has nowhere, if it's plugged, it has nowhere really to go, and can cause more issues. I haven't mentioned it on the talk, but just about cellulitis. I didn't mention it as a slide because it is something that if you do have a cellulitis, which is a bacterial infection of the skin, that you probably, you do need to go to your GP, because that does warrant antibiotics. The cellulitis, and how you would know that it's different from your HS is, first of all, you'll know what your HS feels for you, and that's normal for you. The HS, the cellulitis will be more hotter to touch. The surrounding skin will be more redder. than your normal HS flare, and it tracks. So what we would recommend is if you did feel it was something more than your HS flare, that you would use a skin or a pen or a marker to mark the redness. And if it starts going beyond that border over time, then you need to go to the GP for an antibiotic. These then dressings, again, is just to show you, because I wasn't really, these are the Hydrowear garments. They come in male boxer shorts, female boxer shorts, crop tops and t-shirts. The dressings that come with them, just to show you, they're highly absorbent wound pads, and I think it's up to 80 mils of exudate. So when you put them on, you put them quick change under the garment, and you fasten them on with these fasteners. These can last up to 90 or 100 washes per garment, and then you get a box of 60 dressings with them. And then if you wear, I'll just show you this one is also Tegaderm. Sometimes you can get these in your pharmacy even. These are see-through dressings. If you are out and about and cut short with dressings, you could use a bit of gauze and pack this over, and it will keep it in place. Dressing things, it's just sometimes it can be a bit hard on your skin. Just little things like that can help. Is there any questions? If anyone is to the HS information leaflet book, is a really important one. And then I suppose one things that I hadn't really thought about, because even though HS affects you know, kind of adolescents to premenopause patients, pregnancy was one of the questions that I was looking up, and the HS can get worse, it can stay the same, or it can actually go during pregnancy. And I think it's important when you do have HS and considering pregnancy that you do talk to your GP, because there's a high percentage of patients that have HS that will end up having planned cesareans, because if it's affecting the groin area, they can have normal delivery, but obviously if you're scarred, have a flare down there at the time of birth, you know, you're not going to be happy to do it that way. But also your HS can flare because of increased weight, and we know that obviously HS is affected or can occur more in overweight patients. So just if you were considering pregnancy, putting on weight, it can have a flare. And then just with the C-section, it's also about talking to the person who's going to carry out the C-section about where the scar site will be, because if it's going to affect an area that's normally at the site of your HS, you're going to try and avoid that area. But just little things like that can help. And also, not a lot of patients or people or health professionals may not have heard of HS. So if you are going to different settings like gynae or the CUM or the maternity hospitals, bringing a book with you and telling them from the beginning what you have can definitely help. Also highlight the disease, that it isn't, that it is present, and that people do suffer, and that you do have it yourself. And a lot of patients won't talk about their HS, and especially adolescents, you know, because it's only beginning, they won't talk about that they've one abscess, and eventually those, you know, they can worsen. So it is good that if you do have a flare, you know, that you do talk to the family members and stuff and tell them about your dressings, because it can help them, and they can help with the dressings.